Hey, good morning. I'm Patricia Murphy. It's Tuesday. This is Seattle Now. Stabilizing someone after a drug overdose is critical to their survival, and it's often not the end of their struggle with opioid use disorder. A new recovery option is opening in Seattle this week. We'll learn more about it with UW Medicine's KUOW Banta-Green in a minute. But first, let's get you caught up. Seattle Mayor Bruce Harrell says he's looking at ways to increase security at public meetings after what he calls a deeply troubling incident last week. The city's LGBTQ commission says a person made statements during a public comment period that implied they were carrying a weapon. Security was called and the individual quickly left. An officer contacted the commenter and found they were not armed. Seattle's Office of Civil Rights will look into ways to boost security and says it's committed to public comment and open dialogue. If you're headed out to the water these waning days of summer, check your beach. Several are closed for swimming right now. King County health officials say stay out of the water at Madison Park Beach because of high bacteria levels and Mount Baker Beach because of a sewage spill. Around the region, swimming is also closed at Jean Coulon, Luther Burbank, and Idlewood beaches. Oh, and savor that sweet 8 p.m. sunset. It is the last one for a while. The sun will set tonight at exactly 8 o'clock. Tomorrow, it goes down at 7:58, and it only gets darker from there. Hey, at least we don't have to mess with the clocks until November 2nd. I don't even know why I brought that up. Check back for more headlines on tonight's episode of Seattle Now. Naloxone and medical assistance can be life-saving for people experiencing an opioid overdose. But what happens afterwards is just as important for people who are dependent on opioids like fentanyl or heroin.
The great thing about opioid use disorder is it is a treatable medical condition, and the frontline treatments are medications, buprenorphine and methadone, and those medications support recovery, reduce and hopefully get rid of the disorder, and world's best added bonus, they reduce your chances of dying by over 50%.
The Downtown Emergency Service Center hopes its new clinic will be part of a longer-term relationship with people who need help. It's a place where people can go to recover from an overdose. The Opioid Recovery Care Access Center opens on Thursday. It's called ORCA for short. Dr. KUOW Banta-Green is with the Department of Psychiatry and Behavioral Sciences at the UW School of Medicine. He's been involved with this new clinic from the start. He even wrote the initial grant. KUOW, good to see you.
Great to see you. Thanks for having me.
Let's start by giving listeners an idea of the landscape of care for opioid use disorder in Seattle right now.
We've actually been doing a lot and really pushing the envelope and making a broad array of services available to all sorts of folks across the continuum. We are actually opening this ORCA Center in a very rich environment, but there still is tremendous need. We really see with people with opioid use disorder, generally less than 1 in 4 are getting evidence-based treatments involving medications. So there still is a lot of gap.
Okay. All right. Well, one of the new ORCA clinics, central services, KUOW, is post-overdose care.
Yeah.
So when someone overdoses on a drug like fentanyl, let's talk about what's going on during and immediately after that and how that new clinic can factor in.
An overdose is what it sounds like. It's more of a drug than a person can take. And it could be the first time that person takes the drug. They have very low tolerance, no tolerance. They could overdose on a very low dose. Or it could be a person who's been using for years who has very high tolerance. But given the fentanyl supply, you could get something that's 2% fentanyl, or it could be 80% fentanyl. You have no way of knowing. So during an overdose on opioids, your breathing slows down and slows down and slows down. And eventually you can just stop breathing entirely and die. It's a crisis of oxygen. It's a crisis of breathing. And so the several different ways to get a person to breathe again. By giving the overdose reversal drug naloxone, that person can start breathing on their own within a couple of minutes. You still want to provide the person rescue breathing so the brain gets oxygen in the meantime. And you still want to call 911 because they can provide ongoing respiratory support, breathing support to that person. But then there's this post-overdose window. So naloxone lasts 60 to 90 minutes. Some opioids last longer than that. So a person can actually go back into an overdose. And so one of the things around monitoring is to make sure a person doesn't go back into an overdose. That's less likely nowadays, particularly with fentanyl, which is very short acting. What is much more likely is that a person, particularly who has been given naloxone, will be in withdrawal. And if they're in withdrawal, they feel terrible. And the way you get out of withdrawal is to use opioids again. And if you're out on the street, the opioid that's easiest to get is fentanyl, which costs about $3. What we're really trying to do is offer an option to somebody. Instead of taking fentanyl with unknown potency that's going to last for a few minutes to get out of withdrawal, how would you like to come to this Orca Center, talk with someone who's been through this experience just like you, and get started on these medications to at least manage the withdrawal and help you feel better very quickly, and perhaps move into working on being on those medications long-term, working on recovery or treatment. And so that's what we're really trying to look at, is bridging a person back out of that post-overdose phase and at least an on-ramp onto some health stability, and ideally, if they're interested, moving into improving their health and working towards recovery.
Okay, so what I'm hearing, Caleb, is if someone overdoses on fentanyl, which happens quite frequently in the city of Seattle, and they are saved with a life-saving drug like naloxone, that critical period after that life-saving naloxone is very, very important, because that's a fork in the road. In a way, right? You can fix that discomfort with another dose of fentanyl, or maybe in the case of this clinic, Caleb, someone can step in and offer you different options. Is it a good time to step in and talk to someone?
It can be a real challenging time. The person may physically feel really bad. They may be very disoriented, and they may be surrounded by people wearing uniforms, which nobody likes to wake up all of a sudden in that situation. So is it a good time? No, it's not a good time. Can we help make it a better time? Yes, I think we really can.
Give me an idea of what the Orca Clinic can offer someone coming in, Caleb.
24/7, there will be post-overdose stabilization. Starting off, they'll have 8 recliners that can hold folks there. We expect those folks to be there about 10 to 12 hours. So there might be capacity for up to maximally 20 people post-overdose. So that's one piece, is the post-overdose piece. We actually think that might end up being the minority of what we do. It can also just be people who are in withdrawal, people with wounds, people who've had an injury, and those folks would also certainly be eligible. Also starting off with walk-in access to services, including treatment medications from 9 a.m. to 11 p.m., accessing those medications, as well as, really importantly, peer support, harm reduction education, and then really trying to work on long-term care connections to folks, both whether it's housing, infectious disease support, healthcare, treatment, and so on. And of course, this Downtown Emergency Services Center, they have a wide array of housing supports, really trying to connect them to that. And this is going to be co-located on the same floor next to a behavioral health clinic, so hoping to coordinate with those folks as well.
Interesting, Caleb. And I would imagine that soft contact could build a lot of trust, could help people understand what else they can do at this facility.
Absolutely. I mean, this is really about an engagement-first model, not even necessarily medication-first model, but you've got folks who've been very marginalized, heavily traumatized, understandably don't trust people and don't trust systems. And so it's really a matter of slowly building trust and baby steps with folks so that they will want to come back the next time and the next time and the next time.
The clinic provides outpatient services, meaning people are just there for about a day. Mm-hmm. What happens after they leave that clinic? Do they have a plan in hand?
Yes. I mean, the goal is to have a really good plan in hand, and we know that's hard to do. It's hard to do for any of us. It's hard to do in this fractured system. It's hard to do given what's going on with healthcare. Like, there's a lot of challenges to that, certainly for folks who are unhoused as well. But the goal is for them to have a plan, both with their substance use disorder, their health care, and their housing supports if they need those housing supports. Doing everything we can to provide them a good off-ramp. So we're trying to keep people moving down this pathway towards recovery and health.
I was reading on the website that the goal here is really to provide a very welcoming, meet you where you are environment. How was that planned for when you were building this?
We have staff on my team who have a lot of lived experience. They've certainly been a big part of this. We have a lot of clinical folks who've helped contribute to this. But really importantly, and actually built into our NIH grant, is a Lived Expertise Advisory Board. And we have about 10 folks who've been getting together monthly for the last year. And they're people with, again, lived and living experience of opioid use and opioid use disorder. Almost all have had overdoses. Many have had interactions with EMS or emergency departments. And so we've really been trying to get the folks who are most expert on opioid use disorder and our broken care systems to to help us build something better.
Is there a lot of hope in this, Caleb? What's different that's going on here that people might not realize?
I am very hopeful about it. I think it is really trying to build a different type of place, a place that people want to go to, and a place that wants you to be there as a person who's post-overdose or has opioid use disorder. Our emergency departments are amazing, life-saving places, and you don't want to go there unless you absolutely have to. And so this is really trying to provide an alternative to that.
Has the rise in fentanyl increased the need for something like this?
What we see with fentanyl, it's very strong, and that strength and the short half-life of it does two things. It presents incredible overdose risk, and it also really increases the rate at which people develop opiate addiction or opioid use disorder. So it really has changed things. Even work I was doing a dozen years ago with folks using heroin, the fear of overdose, the fear among people using opioids is so much higher than it used to be, and rightfully so, because the threat of overdose and death is so much higher.
You know, you're making me wonder about capacity versus need for the new Orca Center. You mentioned 8 chairs.
This is not going to fix everything. It's certainly not going to do it quickly. But hey, 700 more people a year getting connected with services, the folks who are the most marginalized, the folks who are having the most difficulty accessing our services, that is a huge difference maker. And you add that up cumulatively over years, that's thousands of people. And I think that's where we really see the change. And so I think it is going to be important that people are patient, that they don't place undue or unfair expectations on one center and one place. And I'm also hopeful that I'll mention this, that we also are in coordination with the King County Crisis Care Centers. We're talking with them about, as they continue to stand up those centers, how might they build in some really similar services and capacity. So it doesn't all just have to fall on the Orca Center. We really hope and think we're building a model that can be replicated in other places and build more capacity.
What does success look like at the Orca Clinic, and how will Downtown Emergency Service Center gauge that?
We're literally going to be looking at people over time and looking at, did they get subsequent EMS calls? Did they go to the emergency department? Did they die? Did they get connected to treatment medications? So we're going to be looking at the exact outcomes that really matter here. We want to know, are we slowing down people's use of emergency medical care? Are we getting people on to recovery with treatment medications? And hopefully, are people dying at a lower rate?
Caleb, before I let you go, you've been working for a long time, to improve the opioid use disorder treatment landscape here in the city and the county. What else is needed? What are you working on next?
A big piece in all of this is really this maintenance capacity. So it's relatively easy to get a person started on treatment medications. The real trick is continuing them on medications. And that means continuing to have low barrier access points where people can continue to get care. And so really trying to work with these different care systems. I think just like the conversation we're having today, really trying to get people to understand that people with untreated opioid use disorder use whatever opioid is easiest to get. And if it's fentanyl, they'll use fentanyl. If it's methadone or buprenorphine, they'll use methadone or buprenorphine. And they will do better, and your community will do better. So we also need communities to really step up and demand and want these services, whether it's the Orca Center or the Crisis Care Center or an opioid treatment program or a syringe services program, that we need and want these services in our communities.
UW School of Medicine's Dr. Caleb Banta-Green, really appreciate it. Thanks so much for your insight.
Thank you very much.
Thanks for listening to Seattle Now. Today's episode was produced by Brooklyn Jamerson Flowers. It was edited by Andy Hurst. Our production team also includes Caroline Chamberlain Gomez, Vaughn Jones, and Paige Browning. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Patricia Murphy. See you soon.